sign my chest. All right, Dr. Paul.
Oh, I actually did.
You actually just wrote on my shirt.
Well, you said to sign your chest.
Gosh, you take things so literal.
It kind of tickles a little
Okay,
bit.
go ahead. Give me one.
Don't say everything.
Okay, I won't look. Okay, go ahead, doctor.
It will be hurt.
All right, that's fine. Go for it. Let's go in. Ah, yeah. Boom. All better now. Yeah. Oh, boy. True confession, I have a couple toenails that look just like that.
I, too, have a couple toenails that look just like that. High five.
High five for the toenails. All right. The point is, it's no big deal. Mine have been like that for years. Do it and you'll be all set. Yeah, this is so easy. Did that hurt? No, take a picture of her. We just did it. Sort of the outline of his cellulitis. We want to know what we're watching. Dr. Paul here. So you saw me struggle and struggle to get out what I thought was a splinter. I'm not sure I got it. A big old clunky thing of wax. Trying to balance it. Bloop. More nerves in our hands and fingers and toes. Yeah, it's like sharp, isn't it?
Just a little bit.
Yeah. So for the viewers who are watching, you know, you gotta be
guys.
tough. You gotta be tough. See a little bit of redness around that white. Get as close as you can. Perfect. Nicely done. So we can see the lower part of the tonsils almost touching the uvula.
Bothering her.
See that cute kid? Who's that? There you are. Uh-oh. I got it in space. It's probably like 2-3 inches wide, both of those patches. There's the other one there. Your whole hand.
Staying pretty brave.
You're very brave. I think your sister's helping a lot. That's great.
Can you still feel your hand?
Yeah.
Did I get the ones up above the crease there?
Yeah, we did.
Okay.
So what we do to, if sometimes the loop of intestine will actually get trapped outside of the abdomen, and that becomes an emergency. And doctors who know what they're doing, and parents can actually learn to do this. If you have this happen, you gently push back and forth. This hand would be cradling the testicle and protecting it. And then this hand is going to gently massage until that loop, those loops of intestine go back into the abdomen. So, straighten. I think I felt a slight pop. I think it's all better.
Oh!
It's working!
Yay!
See the difference?
Yes!
Yay! Yeah, I do not feel any foreign bodies in there. Two down.
Ow.
That's
And
just...
right here too.
Oh yeah, right there too. A lot of little circles. Move on. Come back to it. There. You're doing great. But there's a white 1 or 2 millimeter collection of stuff.
What is that?
We call them tonsillar stones. I'm teasing you, but you're being really brave. I've had this done and it hurts. A little bit of pus at the corner of that nail, a little bit of redness you see. This is not a big infection, it's just a little starting paronychia. Tissue, you start to feel it worse. You're doing great. All right, you're doing great. You guys are gonna miss what we had yesterday, but look at that tube.
Goodness.
So what you're seeing, now you can see some redness of that eardrum, see that? And when I have my otoscope, I can actually see it's bulging a little bit. So you can see the difference of that eardrum around the tube is red.
Is that all blood?
That blackish dark stuff there, that's blood, and you can see it's filling the tube. We're just gonna put that right there. There you go, buddy.
Oh, it's okay. It's okay.
Oh.
Thank you guys.
Yeah, you're welcome.
This was the view outside my bedroom when I was growing up. Isn't that amazing? When you have an illness like this that progresses to shallow ulcers at the back of the throat, which we're going to show you, and then this faint rash that happens to also very slightly involve the feet and very slightly involve the palms.
Do it. Do it.
Oh my gosh.
Okay, that he learned on his own. He taught us.
I was starting to be aware that I didn't quite know what was going to happen even then if I started drinking.
You know as a parent that if somehow they could just, my mom used to say this to me too, if you could just not drink so much or just not drink, you'd be fine.
You'd be okay.
You'd be fine.
Yeah.
But how do you get that message across to somebody who's still in it, right?
Unfortunately, even with your example being sterling, if I don't go through pain and misery, I just don't believe it.
Yeah.
It's just not real to me.
And close to touching, you can see his uvula hanging down, but at the top of his palate are little red spots. Those are called palatal petechiae. Over her left shoulder seems to be pretty comfortable. You can see she's sort of settling into me a little bit here. Ta-da! There you go. Okay, good job. And then usually you can just take this apart like this. There you go. There's your souvenir. And parents have been doing 2 different topical applications of mupirocin, which is a great anti-staph topical antibiotic that's by prescription, and some Argentin 23.
Is it gross, Mama? Kinda. It has to be.
Oh, there it goes. It must have been lobulated.
What does that mean?
That. Here. Dun, 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 dun. Oh, look at that. That is a huge. Okay, I'm sorry. Here. She wants to suck. She's ready to suck again. Oh, let's see. I forgot to grab a stethoscope before I came in here. Silly me. Silly enough. Some kids are a little lip tied up top. It seems to me like this amount of underneath the tongue, there's this thing called posterior tongue tie, and it's like maybe the tongue is attached a little too far forward. This amount that I'm seeing here is pretty standard. Gonna feel the abdomen here. Perfect. We're talking about 28 weeks gestational age. We're not even yet at our due date. Aw, you're doing so well though. Yeah. 1, 2. You did great. And then the next one.
Okay, last time we checked her vision, at least appears that she's fine.
Yeah. Some with fluid in them, and then they'll crust over, like you can see up on the scalp here. Some of those lesions. Maybe we can just show a few on this bottom to show when they get at their worst. So you can get some that get kind of purplish looking. We call that hemorrhagic, partially eaten away. See if we can just get a little bit of that callus to come off. Pectus excavatum, which means it's this way, and that's the technical term. And it's something that is harmless when it's mild, and when it starts getting more severe, just because your heart then doesn't have enough space, that's when they fix it. It's purely cosmetic. And for our viewers, I just wanted you to see a pectus that's reached that point where you want to go get it fixed. Camera, we can magnify it, and we're seeing 1, 2, 3, 4, 5, 6 little legs that are moving, and a fat little whitish body of what must certainly be a tick. Thanks for watching, folks. I'm Dr. Paul.